हार्ड वर्क तो सब करते हैं, मतलब हार्ड वर्क आई थिंक इज अ प्री रिक्विजिट इन एवरी फील्ड, पर कुछ तो डिफरेंट किया होगा.
डॉक्टर के बेटे डॉक्टर क्यों बनते हैं. आई थिंक नीट पीजी एग्जामिनेशन इज मोर अबाउट माइंडसेट.
Medical people, I understand like significant time of their college goes into studies, but is it only studies or is it something else?
पेरेंट्स ने प्रेशर दिया है कि डॉक्टर बनना है, फैमिली का प्रेशर है, एंड दे आर नॉट इंटरेस्टेड एट ऑल. उनको तो बिल्कुल नहीं करना चाहिए.
What is the major difference between a government college vis-a-vis a private college vis-a-vis a person who studies from abroad? Welcome viewers to yet another exciting and insightful episode of Think Tank with Aman. Think Tank is all about bringing people from different walks of life and breaking down variety of career options. And today is one such day where we deep dive into one of the most coveted career options since ages, medicals. Pursuing a medical career is one of the most challenging yet considered to be the most rewarding and prestigious career options even today. And I couldn't have thought of a better guest than him. A person hailing from the small town of Siliguri and studying from Delhi schools. He has cracked the NEET UG examinations and has studied into one of Calcutta's best medical colleges, Medical College Calcutta. Doing an internship and treating 30 patients every day, and with over 2 distinctions, he has now achieved yet another significant milestone, and this time it's a really big one. He has achieved All India rank 411 in the NEET PG examinations and is now headed for his dream career into internal medicine. Let's welcome Dr. Rishabh to the show. Welcome, Rishabh, and congratulations on such a significant achievement.
Thank you, Aman. Thank you so much. Thanks for having me here. It's a pleasure to be here.
So nice to see you here. So Rishabh, tell me, what did you do something different? I mean, AIR 411 out of 2 lakh plus candidates appearing for the PG examinations. हार्ड वर्क तो सब करते हैं, मतलब हार्ड वर्क आई थिंक इज अ प्री रिक्विजिट इन एवरी फील्ड, पर कुछ तो डिफरेंट किया होगा.
I think NEET PG examination is more about mindset. You know, it's like hard work तो है ही, उसके साथ साथ you need to work smart, and it's a very big syllabus and you need to concise that syllabus into like a concise notebook or something of your own and then revise it over and over again. It's not like कि ज़्यादा पढ़ना है, it's like कम पढ़ना है but smartly पढ़ना है and उसी को बार बार पढ़ना है. And plus the mindset of solving MCQs, it's an MCQ exam, so like even if you don't know the answer to an MCQ, you can get that MCQ correct. So it's all about the mindset.
Amazing. So I'll take you now back to your roots. I think it has been a long journey for you.
Yeah.
So take you back, I think, to class 10th.
Okay.
So why and how did you decide to choose a medical career?
So it's a very funny incident that I had. So class 10 में I got good marks and then I was always oriented towards science कि मुझे साइंस ही लेना है, and मैथ्स मुझे इतनी पसंद थी नहीं. तो फिर इंडिया में उस समय पे कि 2 ही ऑप्शंस होते थे, या तो साइंस में कि ईदर यू गो फॉर इंजीनियरिंग और यू गो फॉर मेडिकल. सो उस समय आई डेंट थिंक अबाउट इट टू मच एंड आई वेंट इनटू दिस नीट यूजी कोचिंग फॉर इन क्लास 11 and 12, and then I started liking it and I started to develop an interest and here I am today.
Got it.
Yeah.
So मतलब was there anything in plan और मतलब कुछ भी आइडिया था कि मेडिकल करना है कभी भी, कि was it all like a fresh, मतलब कहीं से तो इंस्पिरेशन, some spark of inspiration might have arisen?
हाँ, जैसे पापा के कुछ फ्रेंड्स आर डॉक्टर्स एंड आई रियली लाइक देयर लाइफस्टाइल एंड हाउ दे आर डूइंग, सो उससे थोड़ा इंस्पिरेशन लिया था मैंने. एंड आई वाज ऑलवेज इनटू हैविंग अ प्रोफेशनल डिग्री फॉर माई सेल्फ, सो दैट हेल्प्ड. बट मेरा कुछ ऐसा प्लान था नहीं, वो हो गया बस जैसे भी. बट आई थिंक आज इफ़ एनीबडी इज़ कंसिडरिंग टू गेटिंग इनटू मेडिकल्स, ही नीड्स टू थिंक अ लॉट बिकॉज द कॉम्पिटिशन हैज़ इंक्रीज्ड like by many folds, I guess. So बहुत सोच समझ के अब डिसीजन लेना चाहिए किसी को भी, I think.
Definitely. And I think so यहाँ पे when you're talking about the competition, so there is something so it's always said that it's easier for a doctor's child to become a doctor, or there's this notion that is there in the society.
Mm-hmm.
So do you think, is it right? I mean, should a doctor's child only pursue a doctor degree? How is the pressure extremely high on the particular child? Do you think is it right? So I was reading a fact. So this year I think 24 lakh students
Yeah.
appeared for the NEET UG
Yes.
examinations, right?
That's huge. Yeah.
And that's like a remarkable number, like something that is beyond imagination. And
Yes.
there is only 1 lakh MBBS seats, I think
Yeah.
around 40-50,000 for government and remaining for private.
Yes.
Knowing that these chances are so slim and at a young age of around 15 to 16, hardly 16 years age,
Yeah.
and pursuing a 10-year, at least a 10-year career where there is no looking back.
Mhm.
So what do you think? Is the pressure right enough, and like how difficult is it?
So answering the first part of your question, like डॉक्टर के बेटे डॉक्टर क्यों बनते हैं? So basically a doctor knows कि lifestyle कितनी अच्छी है and he wants the same for his child because life काफ़ी sorted है वैसे देखा जाए तो as a doctor. You earn good, you are well respected in the community and you have a stable job and job security basically. You can start anywhere. So वो सोचते हुए every doctor wants his child or wants his child to get into medical field. Coming to the second part of your question कि competition बहुत बढ़ गया है. So like you said 24 lakh students appeared for this examination and there are 1 lakh seats and we are keeping the reservation part aside. There's almost 64% reservation in medicals.
Oh my god.
Including मतलब SC, ST, OBC, economically weaker sections, person with disabilities सब मिला के it's 64.5%. So we are talking about 36,000 seats including private and government seats for a general candidate. So that's huge competition. If you take out the percentile, I think it's in it will be around 0 point something 1.5%. I think 1.5%. Yeah. So yeah, the competition is huge. So that's why I told you like अब कुछ अगर किसी को घुसना है इस फील्ड में he needs to be very passionate about it and he needs to be very determined कि हाँ मुझे ये क्रैक करना है and I am ready for this 10-year long journey. Only then a person should enter this field, I think.
And adding on to it, so you are a first time doctor in your family. I think
Yeah.
as far as I know, nobody is a doctor in your family.
No.
So how difficult vis-a-vis a doctor's child is it for a first generation doctor to crack his career and his path?
I think the exam is the same. So basically, the pressure is the same for both a doctor's child and a non-doctor's child. But a doctor's child gets a little more help from his parents during this preparation phase because they've passed through the same thing, and they can get him into better coachings and better help for him basically. So that's all that matters. मतलब that's all that's different among a doctor's child and a non-doctor's child. बाकी exam तो सबको crack करना ही है.
Got it. And what according to you, who are those kind of people who should definitely not pursue medicals? मतलब ये दो तीन category of genre of students है जिनको definitely medicals pursue करना ही नहीं चाहिए.
ओके एक जो पेरेंट्स के प्रेशर में कर रहे हैं कि पेरेंट्स ने प्रेशर दिया है कि डॉक्टर बनना है फैमिली का प्रेशर है एंड दे आर नॉट इंटरेस्टेड एट ऑल उनको तो बिल्कुल नहीं करना चाहिए सेकेंड आई थिंक इफ़ यू गिवन नीट यूजी फॉर 2 years back to back and you are not being able to crack it, I think you should exit this field because अगर 2 बार में नहीं हुआ then it's fairly difficult to crack for the third time. There are instances, but I think it's not worth wasting another year because it's already a very long course. And third, I think जो नॉन सीरियस कैंडिडेट्स है जो ऐसे ही ले लेते हैं कि इंजीनियरिंग नहीं हो रही तो मेडिकल ले लेते हैं सो
one more quality, I think people who have patience. I mean,
हाँ
जिसको हड़बड़ी है उसके लिए डॉक्टर फील्ड आई थिंक इट्स वेरी वेरी.
हाँ doctors need to have a lot of patience, yes, because we encounter very different kinds of patients every day and we need to be ready to deal with all of them. So patience is a very important virtue for a doctor.
So I think patience, madness, and like sheer dedication towards this field are the 2-3 advice for aspirational doctors. So now can you help me break down what is a typical journey of a doctor, like in short, like right from class 10 to masters or a super specialized till a doctor becomes a practicing doctor in a hospital?
Okay. So the journey starts from class 11. You go into NEET UG coaching, which is typically for 2 years. So 11th and 12th you are doing your school course along with this coaching thing, and then you give your NEET UG examination after 12, or some people even take a drop year after 12 to give the NEET UG examination. Then it's a 4.5 year course, the MBBS, and 4.5 year course followed by 1 year of internship, which is compulsory internship. Then you're awarded the MBBS degree. Then comes the NEET PG examination, which is for the postgraduate courses. So typically it takes 1 year to prepare for that exam, and then you give that exam, and then you enter your MD or MS. MD is for medicine and MS is for surgical fields. So that's a 3 year course again. So after you complete this 3 year course, there are bonds like government. If you're studying from a government college, there are bonds like you have to serve the government for this many years.
Post your MDMS.
Post MDMS, you need to serve the government for 2 years, 3 years, depends on the state. So you can get out of that bond if you can pay the money, the bond amount,
Got it.
and after that you go into super specialization. Coming back to MD and MS, MD and MS में there are some branches which are end branches जो खत्म है वहीं पर, like you don't have to study further.
Got it.
For example, radiology is an end branch, psychiatry is an end branch, orthopedics is an end branch. You don't have to do anything further. But the mother branches like medicine, surgery, you need to study further. You can study further, you don't need to study further. So those courses are called super specialization courses, and for that again, if you want to do it from India, there is an examination, NEET PG SS, NEET SS examination. So you
How
said
long is that super specialization
that's
for?
again 2 to 3 years depending on the course. So that's called DM for medicinal branches, and MCH for surgical branches.
Got it. So do people opt in for that with that trade-off of 3 years, or like is it?
See, with increasing competition in the medical field, it's better to have a super specialization degree with you, so that patients can
Trust
patients
you
get
better.
attracted to you basically, and they trust you better, and you gain expertise in that field. So you are the master of that field. So
Got it.
people will be attracted to you. Yeah.
So now talking about that 4.5 year college life in medical. So you have a lot of friends who are non-medical students. Even I can
Yeah.
pitch in somewhere. So apart from the time duration, like since a non-medical field is like 3 years of college, now it's become 4 years because of the new
Yeah.
rules. But what are the other differences in terms of regular lifestyle or friends or studies or anything from a medical and non-medical perspective?
Yeah, so I have a lot of non-medico friends, and I can give you a good answer for this one. So basically, MBBS is a professional course, and our college is more academically inclined. So जो भी हमारे कॉलेज में होता है, it's related to academics. We don't have societies like you guys have. We don't have extra co-curricular activities like you guys have. We are less inclined into sports, and most of the time you'll find the medical students studying or attending classes or attending practicals or going to the wards and seeing patients. So that's the main difference. Basically, we are totally into academics, and
Got it.
we don't have a life beyond academics. Yeah.
Got it, got it.
Yeah.
So apart from this, मतलब एक हो गया life, मतलब this is a typical life. So there is like a huge misconception also, like medical people. I understand like significant time of their college goes into studies, but is it only studies or is it something else?
No, we have a lot of fun. That's for sure. Medical students have a lot of fun. We Calcutta, like my college, Calcutta Medical College, used to host a very big fest from which was called Rhapsody, and people from all colleges used to attend. So fest वगैरह, cultural events वगैरह होते हैं, but it's not as much as your college.
Got it,
And
got it.
students don't like to get involved voluntarily because they are so much under the pressure of exams and vivas and practicals कि उनके पास टाइम ही नहीं होता, and very less people get into it. But yeah, medical college is fun. Like we have a lot of fun college के अंदर ही. So I made very good friends in college, and I had a really good time. Plus internship was really fun for me.
So now talking about, since you are from a government college, so one thing, how important is the brand value of the UG college in particular? I mean, जरूरी है क्या एम्स का ही डॉक्टर होना पड़ेगा तो ही उसके पास पेशेंट्स आएंगे? आई नो देयर आर सो मेनी डॉक्टर्स आई आल्सो नो इन पर्सनल हु हैव डन हु हैव परसूड यूजी और पीजी फ्रॉम समवेयर और the and are doing really well in their
Yeah.
practice.
Hmm.
So is it important? How important is the brand value of the college? And the second question is ki, what is the major difference in terms of between a government college vis-a-vis a private college vis-a-vis a person who studies from abroad?
Okay. So answering the first part of your question, like how important is the brand value for a UG college? For a UG college, the brand value does not matter as much, honestly, because nobody remembers UG कहाँ से किया था.
अच्छा.
Because UG के बाद you are having to do two more courses, which is MD and
super
DM.
yeah.
So तब तक everybody forgets कि MBBS कहाँ से किया था. You need to be doing it from a good college बाद में, like the MD and the DM part. MBBS I think is more or less the same everywhere. एम से कर लो या प्राइवेट कॉलेज से कर लो, इट्स मोर और लेस द सेम एवरीवेयर. बट अगेन गवर्नमेंट कॉलेजेस से करने का फ़ायदा ये है कि यू गेट अ लॉट मोर एक्सपीरियंस, लाइक यू गेट टू सी अ लॉट मोर पेशेंट्स, द पेशेंट लोड इज़ वेरी हाई एंड यू गेट टू सी अ वैरायटी ऑफ केसेस. Now coming to the second part, ki government versus private versus FMG, what is the difference? So like I said, government में there's a very high patient load. Government colleges में meritorious student center, like the
Cream of
the cream students are always in government colleges. Private colleges में, the government colleges में academics is more or less okayish. Professors don't focus as much, and being very honest with you here, and all जो भी करना है तुम्हें खुद से ही करना है वहाँ पर.
Got it.
But practical classes are good. Government colleges में you get a lot more
exposure.
yeah. And private में the second private में क्या difference है कि private का academics is very strong. They have very good professors. They pay the professors really well, so they get good professors. And secondly, the fees private में fees is exorbitant nowadays. Like it takes around 1 CR
for a
for a 5-year course to complete your MBBS, like, which is
Very
exorbitant.
high.
Government colleges में there is no fees. It's minimal. Like my fees was, I guess, 4,500 per semester. So that's
a huge
negligible.
difference.
Yeah, that's negligible. And foreign medical graduates now. So there was a trend बीच में कि people were going to Russia, Ukraine, even China to get their MBBS degrees. Nepal में it's very common. People go to Nepal. But now the government is getting stricter with the FMG rules. So abhi recently I read कि all the foreign medical graduates who graduate from abroad, they have to come to India and do a 2-year internship in Indian medical colleges. Plus, they have to pass the FMGE exam, which is equivalent to the NEET PG exam. So you have to study as much for the FMGE exam to just qualify to practice in India. So I think it does not make sense now. Pehle it was okay because
Is the duration same? Matlab
yeah, the
4.5
duration,
years
yeah, the
or
duration,
5.5 years? Four
yeah,
and a
the
half plus 1 year.
4.5 plus 1 year, the duration is almost the same. It's 5 years, I think. It's not 5.5, it's 5 years out
years.
there. But again, 2-year internship यहाँ करना ही पड़ेगा compulsory, and you have to pass the FMG exam. So it does not make sense to go abroad and do your MBBS. उससे better you can take, if you're not getting a good government college, you can take a private college here.
Got it.
So that makes more sense because
And
fees
we
तो
are not
same ही
allowed
है.
to take into government colleges outside India. So there might be only private colleges outside
Yeah,
India.
yeah,
I
yeah,
assume.
yeah.
And how is the fee structure there?
It's almost the same as a private medical college in India. It's around 20 lakhs per annum.
Got it.
So that's almost the same. So it makes more sense to stay in India for MBBS. Like,
And is the certification valid, or do people see you as the same way as an Indian medical student?
yeah, after you pass the FMG examination, it's the same.
The same.
Yeah, it does not make a difference. You can practice freely in India. Nobody's questioning you.
And what is the major difference? What happens inside a UG versus inside a PG? So, I mean, the 3 years of PG, what does a trainee doctor do inside a PG vis-a-vis a UG?
Okay, so UG comprises of 19 subjects. So we divide it into preclinical subjects, which are the first year subjects: anatomy, biochemistry, and physiology. Then second year में there are the paraclinical subjects, which is pathology, pharmacology, microbiology, and forensic medicine. थर्ड ईयर में एंड फोर्थ ईयर में यू गेट क्लिनिकल सब्जेक्ट्स. सो दोज आर ENT, ophthalmology, community medicine, medicine, surgery, obs gynae, pediatrics, radiology, orthopedics, psychiatry, dermatology, and anesthesia. So these are your 19 subjects. Now ये होता है यूजी का 4 ईयर का 4.5 ईयर का कोर्स. You get to know about each subject, you study about each subject, you go to attend the practicals of each subjects, and internship mein you attend the postings of each department.
So is it enough in a year to attend postings of each department and get sufficient exposure?
Yeah, so we get posted in each department for like 2 weeks, 3 weeks, or a month. वैसे करके we are posted. So we complete 19 subjects का postings during that period. एंड सो इससे तुमको आइडिया लग जाता है कि व्हाट इज़ द करियर यू वांट टू परस्यू आगे. एंड देन कम्स द PG. सो PG you choose one subject of out of the 19
subjects.
Yeah, and then you specialize in that subject for 3 years. And PG में पढ़ाते नहीं है, it's an on job training basically. You are working and you're learning as you're working. Professors teach you on rounds, not you don't have any specialized lectures or anything. You have lectures once or twice a week, but वैसे जैसे UG में होता है कि lectures practicals वैसे नहीं होते. You're working and you're learning.
And you're earning also at the same time, right?
Yeah, you get a good stipend as well.
So between a PG from a government college as well as from a private college, what's the major difference with respect to fees or the exposure that you get or the stipend that is there?
See, PG में there's a huge difference between a government and a private medical college. So government medical college में, like I said, patient load is very high, and PG में you're learning as you are working. So जितना ज़्यादा काम करोगे उतना ज़्यादा सीखोगे. तो variety of cases ज़्यादा है, patients ज़्यादा है, professors better है, senior junior relationship बहुत अच्छा होता है government में. Whereas private में the difference is कि वहाँ पर patient load तो बहुत कम है, and academics वहाँ strong होंगे, but you're not working as much and you're not getting that exposure.
No.
And PG में all that matters is exposure and hands-on experience. So you're not getting that level of hands-on experience. And coming to the fees part, government colleges में again there's negligible fees, and you're paid quite handsomely. मतलब not as good as maybe 25-year-old would must be earning.
Got it, yeah.
From a different stream, but you're paid well. And fees negligible. So fees negligible plus a good stipend in a government medical college, whereas private medical college में the fees is exorbitant again. It's again around 30 to 35 lakhs per annum, and the stipend doesn't matter वहाँ पर. तो
Got it.
बस गवर्नमेंट में ये है कि there's this bond thing कि 3 साल या 2 साल सर्व करना है गवर्नमेंट को, एंड उसके लिए जो बॉन्ड अमाउंट यू पे उसी को फिर फीस मान के you can.
So what is like a typical bond amount that is there?
One year typically costs you 10 lakh.
Got it.
So if it's a 3-year bond, it's 30 lakhs
Got it.
typically,
That-
but it varies from state to state. Yeah.
And how many hours do you work on a PG internship? I have heard multiple stories of people, so very curious.
See, for a first year, the working hours are insane. It's more than 80 hours a week. Sometimes it might even cross 100 hours a week. But ठीक है, that's how it's been for so long, and वो grind करना ही पड़ता है. Everybody has to pass through that. Every doctor has passed through that. So उसके बाद फिर second year and third year it gets relatively easier, but first year is difficult. Yeah.
Got it. Now I think we are on the final leg in this podcast. So one question that a lot of aspirational medical students have is ki, whether we should go to Kota for studying, for taking the UG coaching. I think for a lot many years Kota has been the engineering and the medical factory. And I can remember an instance. I remember when I had gone to Kota for my brother's admission, I saw Alan students in green t-shirts, and it looked like a factory of students were coming out from that institution. So what is your thoughts on that? And now with respect to these companies like Physics Wala, Akash, Alan opening their centers in different parts of the country. So do you still think one should go to tier 1 city or Kota for that matter?
Okay, so NEET UG counseling में there is something called the All India quota and there is something called the state
State.
quota. State quota में 85% of the seats होती हैं and All India quota only accounts for 15% of the seats. So let's take an example of a student from Siliguri itself. तो सिलीगुड़ी का स्टूडेंट है, if he wants to study in a Delhi college, Delhi colleges are generally the best ranked colleges of India. The top five colleges of India are in Delhi. So if he wants to study from a Delhi college, he is only eligible for those 15%
15%.
seats. So he has a domicile of West Bengal, so he is getting 85% seats wala quota in West Bengal. This is done because of the language thing, because medical में the language barrier matters, क्योंकि when you're interacting with the patients you need to know the language, because most of the patients are from the lower socioeconomic status government
Got it.
colleges में, and they don't know Hindi or English as well. They are more fluent in their mother tongue.
Yeah.
तो इसीलिए गवर्नमेंट ने ये कर रखा है कि 85% स्टूडेंट्स अपने ही स्टेट में रहने चाहिए, विच इज़ फेयर आई गेस. तो कोटा जाने की बात जो है, बेसिक मोस्ट ऑफ द स्टूडेंट्स नाउअडेज व्हाट दे आर डूइंग इज दे आर टेकिंग डमी स्कूल्स फ्रॉम दिल्ली सो दैट दे गेट दैट दिल्ली कोटा. वो 85% उनको दिल्ली कोटा के लिए वो एलिजिबल हो जाते हैं इफ दे आर गिविंग देयर 12th का बोर्ड्स फ्रॉम दिल्ली, एंड देन दे गो टू कोटा. नाउ कोटा, वाई कोटा? तो कोटा फैक्ट्री का एक बहुत फेमस डायलॉग है कि कोटा आपको माहौल देता है. कोचिंग सब जगह सेम है बट कोटा वो माहौल प्रोवाइड करता है. वो जो कॉम्पिटिटिव माहौल बना देता है कोटा, बिकॉज द बेस्ट स्टूडेंट्स गो टू कोटा एंड द बेस्ट टीचर्स आर सिचुएटेड इन कोटा. मतलब एलन के भी एलन हर जगह है आज, फिजिक्स वाला हर जगह है आज, बट उनके बेस्ट टीचर्स कोटा में ही हैं अभी. तो वो कोटा जो कॉम्पिटिटिव माहौल है, एंड वहाँ पर स्टूडेंट के पास और कुछ है नहीं करने को. वहाँ पर वो सब जहाँ देख रहे हैं वहाँ पर उसे एस्पिरेंट्स दिख रहे हैं. तो वो माहौल में आई थिंक दैट गिव्स द स्टूडेंट द एज, कोटा के स्टूडेंट को एज. बट अगेन दैट कैन बी काउंटर प्रोडक्टिव टू, कि काफ़ी लोग वो प्रेशर नहीं झेल पाते हैं एंड देन वी हर्ड हॉरर स्टोरीज अबाउट कोटा. सो लाइक इट डिपेंड्स ऑन द स्टूडेंट, बट या आई थिंक कोटा इज़ अ वेरी गुड चॉइस फॉर स्टूडेंट्स. बट अगेन tier 2 tier 3 cities में भी अब coaching centers are coming up now with the introduction of online coaching. You can do it from your home as well. So I think depends on the student कि अगर he wants that mahal, he should go to Kota, but otherwise he can do it from his home as well. It's as good.
I think then it comes to the person. So how
Yeah.
does he take that particular coaching?
Yeah.
So I think the final question is, like, we have heard a lot of myths and misconceptions about a medical field. So one thing is कि medical students हमेशा पढ़ाई करते रहते हैं, and I think अगर कोई medical student, if you see a medical student in any function or a party, you see कि अरे तुमको time भी मिलता है क्या? So what is your take on that? And we'll come to other misconceptions later. But yeah.
नहीं यार, ऐसी बात नहीं है कि मेडिकल स्टूडेंट्स पढ़ाई करते रहते. you've known me for a very long time and you know कि I am very active in social events and I have my fun. I am traveling a lot, so that's not true. But yeah, we study more than different courses for sure. But ऐसा नहीं है कि बिल्कुल टाइम नहीं मिलता. If you're studying for like 2 to 3 hours a day MBBS में, it's more than enough. And for your NEET PG coaching time, like if you're studying for 6 to 8 hours, I think that's enough. I did 6 to 8 hours honestly, and that was more than enough for me.
Got it.
Yeah.
So some other misconceptions, I think one is कि doctors are always wealthy and they take a hefty charge. They should not charge. I think for a 2 minute they charge 1,000 and even more than that. So what is your take on that?
यार ये भी तो देखना पड़ेगा ना कि वो 2 मिनट का चार्ज करने के लिए ही हैज़ गॉन थ्रू अ जर्नी ऑफ 15 years. उसने अपने 15 years इन्वेस्ट किए हैं, उसने पैसे में इन्वेस्ट किया है, उसने टाइम में इन्वेस्ट किया है. ही इज़ चार्जिंग यू 2 minutes का दैट 500 or 600 rupees. He is not charging you for those 2 minutes. He is charging you for the entire journey.
15 years.
Entire journey, yeah. So.
And what about doctors are always wealthy and doctors are always considered to be the rich folks in the society? And you also mentioned in the starting that कि वो prestigious है, and obviously it's prestigious. I mean, doctors have a good pay. So is that true for every doctor? Because nowadays we have seen there are so many doctors that are there, and only a handful of doctors are one whose practice actually works and whose practice are actually renowned in the city.
सी डॉक्टर कभी भूखा तो नहीं जाता, ये तो नोन फैक्ट है कि एक डॉक्टर कैन अर्न अ गुड अमाउंट फॉर हिमसेल्फ एंड ही कैन सस्टेन हिज फैमिली वेरी वेल. बट कमिंग टू द वेल्दी पार्ट, नॉट ऑल डॉक्टर्स आर वेल्दी. मतलब यू नीड टू बी वेरी गुड टू बी अर्निंग लाइक अ decent amount. You need to be working at a good corporate hospital, or you need to have a huge setup of your own. That depends on the person. हर फील्ड में अब there are people who are doing good and there are people who are doing average, but the average of doctors is better than the average of others. That's
Okay.
the main point. Yeah.
Any other misconception that you would like to break here with respect to doctors or a medical field or pursuing a medical field? And any final suggestions for all those aspirational medical students or people who want to pursue medicals?
Okay.
Any final thoughts?
So, to all the aspirants out there, NEET UG or PG, I would like to say कि keep a positive mindset, be determined and be disciplined. Discipline and consistency will get you through. You just need to work smart, you need to have the right sources, and you need to be consistent with your work. That's it. You'll get through any exam, you'll get through anything. बस यही है कि मन से करना है जो करना है. बिना मन से किए हुए काम में सक्सेस मिलनी बहुत मुश्किल है, एंड स्पेशली इन दीज टू एग्जामिनेशंस, नीट यूजी एंड पीजी. एंड what else did you ask me?
I think any final misconceptions that you would like to break?
Okay, so okay, there's this very common misconception कि ये डॉक्टर बहुत महंगी दवाइयाँ लिखता है, या ये डॉक्टर टेस्ट बहुत करवाता है. एंड यू आई थिंक
Yeah, I think everyone can relate to that. Yeah.
हाँ, अगर टेस्ट नेगेटिव आ जाए तो टेस्ट बेकार था, बेकार में करवा लिया ये टेस्ट. So see, in medical field is very uncertain and it's indefinite. मतलब कोई fixed syllabus या ऐसा कुछ तो है नहीं, कोई book तो है नहीं. It's a dynamic field. It is continuously changing. तो टेस्ट जो हम करवाते हैं, even we don't know for certain कि क्या है. We are ruling out possibilities one on one, एक एक करके कि ये नहीं है, ये नहीं है, ये नहीं है, तो ये हो सकता है. That's our rationale behind giving those tests. And coming to medicines, I'll give you a very good example. So everybody knows कि diabetes में the main aim of the treatment is to lower blood sugar, right? सबको पता है ये बात. तो अब एक दवाई है which is called glibenclamide. It has been present since 50 years and उसकी एक tablet is 1.5 rupees per tablet. तो works very well. डायबिटिक्स को स्टार्टिंग मेडिसिन हम वही देते हैं जनरली. तो सब एवरी पेशेंट इज़ ऑल्सो हैप्पी कि सस्ती दवाई है, सब कुछ सही है. अब रिसेंटली 5 to 7 years ago देयर इज दिस न्यू ड्रग इंट्रोड्यूस्ड विच इज़ कॉल्ड दी SGLT2 इनिबिटर. तो उसके काफ़ी ड्रग्स मार्केट में आए थे. एंड उसमें रिसर्च हुई, तो रिसर्च में पता चला कि इट सिग्निफिकेंटली रिड्यूसेस द रिस्क ऑफ कार्डियोवैस्कुलर अनोमलीज इवेंट्स फ्यूचर में. What would you prefer? That एक tablet costs around 20 to 30 rupees. What would you prefer?
I think the second one.
You'd prefer the second one, right?
Yeah.
But the patients don't understand this. If I give them the second drug, they'll be like कि ये महंगी दवाइयाँ देता है, वो सस्ती दवाई देता है. So that's a very big misconception that's present among.
I think little knowledge is a dangerous thing. I
Yeah.
think that is what we can say.
Yeah.
I think thank you so much, Rishabh, for coming here, and it was a pleasure hosting you. Thank you so much, viewers, for staying till the end. Stay tuned for the next episode. Thank you.